Get informed. Get educated. It's all about your health. This is Healthy Living with Dr. Lateef Akinola.
Good morning. This is Dr. Lateef Akinola, consultant obstetrician and gynecologist practicing in Lagos at Medicine Specialist Women's Hospital. I founded it and I'm the CEO and CMD of the hospital. Today, this is our next series of Healthy Living podcast series we are doing today. And we have a special guest in the person of Dr. Edmund Edi-Osagie, FRCOG, FWACS, and with a special guest that's based in UK, and he comes on regularly to give back, medical tourism, treating patients off sleeve, and he's been helping a lot of patients when he's around in Lagos. He comes almost once every month. We're going to speak to him today to find out what actually inspired him about this medical tourism back to Nigeria. Good morning, Dr. Edi-Osagie. You are welcome, and I thank you very much for agreeing to, give a podcast about your sojourn in Nigeria, medical tourism aspects of it. Could you please give us a little bit about your background?
Absolutely. And thank you so much, Lateef. Thank you for having me. I'm delighted to be here. So my name is Edmund Edi-Osagie. I am a consultant gynecologist, and I am based in Manchester, UK. As you rightly said, Lateef, I have been coming home regularly over the last 6-7 years to try and give something back to people of this country. I've been in the UK for about 32 years now. I did my initial undergraduate training here in Nigeria at the University of Benin, graduated in 1985, did a bit of postgraduate training here, and then went over to the UK in 1993, where I completed my postgraduate training, did my specialist training in reproductive medicine and surgery, did an MD at the University of Manchester, and since then I've been a consultant gynecologist at the Manchester Central Hospitals. I left the NHS 2 years ago, so I just do private practice now. And as I said, I have been very interested in coming back to Nigeria, giving something back. I started doing medical tourism with the West African College of Surgeons UK Forum for the last maybe 10-12 years. And as you know, we go around different countries in West Africa to just deliver free healthcare. And I really, really enjoyed that. I felt it was very, very fulfilling. And that got me thinking about what I can give back to Nigeria, because I recall I was trained by this country freely. I didn't pay tuition fees, I didn't accumulate any debts going through medical school. And when I got to the active phase where I could actually give something productively back to the country, I traveled to the UK for obviously advanced training, and I have been there ever since. So it's been a delight for me to come back over these last 6 years to be able to give something back. And I come regularly. I come maybe every 2 months or so. And I'm happy that I've been able to collaborate with you to both bring advanced laparoscopic surgery treatment to our patients, and also to bring training and skills transfer to our younger doctors who are the future of healthcare in Nigeria. So I'm delighted to be here, Lateef, and I look forward to this chat with you.
Thank you so much. That's quite vaccinating, because we have a lot of Nigerians abroad, and only few, take cue from what you are doing, and they do come back for medical tourism. So I know that when you come, you must have been spending a lot. Do you have a grant, or what is the cost implications? You even bring along equipment you use, consumables you use, and then I can imagine that as a private practitioner, you must have patients that you say, "Oh, I'm going to Nigeria. You just have to wait. What's actually is the cost implication for this?
So that's a really interesting question. One of the it's a combination of both, really. I really feel that if you're wanting to give something back, you have got to just accept that you're giving something back and not worry about what it costs you. Because if you do this for what you get back from it, you'll not be able to do it. Because for one, you probably don't get back anything apart from just the blessing of knowing that, and the satisfaction that gives you. And nothing can beat that. From the days when we started with the Wax West African Forum, one of the models we established was before each medical mission, we go around to the medical equipment makers, drug manufacturers we work with, ask them if there's anything that they can donate towards the mission that we're doing. And sometimes you get a few things from them. And that's, so we started from there. And sometimes the hospitals we're working will have some equipment that they do not want to use anymore, or, things that they want to give away. And sometimes we're quite, you have an ear to the ground. So you find out about these things and you make sure you try and get as much of these things so that when you're coming, you're able to bring those things down. So that has been helpful. But in terms of funding the visits, we don't get any grants. So this is all funded by ourselves. And it's just, as I said, it's just part of giving something back. And, the satisfaction, the blessing you get from doing it outweighs any amount of money, So it is a pleasure. And by God's grace, we have been blessed, with good jobs. We have been blessed with jobs that provide the resources for us to be able to do this. So I think in my own little way, I'm paying Nigeria back for all the investment they put in me.
Fantastic. Yeah, I'm really impressed. You actually put in a lot, making this a possibility. Now, you are as an obstetrician and gynecologist. I'm sure that your medical mission here is focused on your specialty. So what are the cases you've been meeting in Nigeria and treating along the way?
That's really interesting. So I trained as an obstetrician gynecologist, but my specialist interest area has always been reproductive medicine and surgery. And I've been very fortunate. I worked in a university teaching hospital in Manchester where I did not have to do any obstetrics at all. So I've spent my whole career doing gynecology and doing advanced gynecology, which I really enjoy doing. So mainly reproductive medicine, the full scope of fertility and assisted conception, and reproductive surgery, advanced laparoscopic and hysteroscopic surgery. And I was a preceptor for the RCOG training program in advanced laparoscopy and hysteroscopy. So coming to Nigeria, one of the things I found from the very early days is that there is a dearth of specialists providing advanced laparoscopic surgery. And I think we have chatted about this, and I was very, very keen. And when you think about the anatomy, the physiology of African compared to Caucasian women, it's quite clear that laparoscopic surgery is something that will be very, very beneficial to our women. So I was very, very clear that I would want to offer my expertise to try and both provide direct treatment to patients who need this and also to help train the younger generation. And that's what I've been trying to do. So I have been providing expertise in advanced laparoscopic surgery, especially to do with advanced endometriosis. As you know, endometriosis is such an enigmatic condition and one that can be challenging at the best of times. And I recall when I was training here in my early days in the university, our professors used to say endometriosis is a disease of white women, while fibroids are a disease of black women. And we grew up thinking that was the case until I went to the UK and found that endometriosis affects all races, irrespective. And half of my women are black women. So interestingly, comparing the scope and the stages of endometriosis I find here with what I'm used to in the UK, it's very interesting. And I've been trying to answer the question, why is it that the cases we find here seem to be very advanced and actually more challenging than the cases we experience in the UK? And I still don't know the exact answer to that question, except that maybe in the UK, there is a lot of primary care. So patients go to see their GPs really early. And from there, they get referred to hospital and they might get diagnosed early and get treatment early. But even in the UK, we know that there's still a lag time of about 7 to 8 years to the first diagnosis of endometriosis. So it might be that we're dealing with a disease that manifests differently in different races. And I have noticed here that there is a lot of extrapelvic endometriosis. So I've seen a lot of umbilical, a lot of inguinal endometriosis. I've seen a lot of chest endometriosis compared to what I experienced in the UK. And some of the presentations of the endometriosis I see here in our women, like in a young lady, I operated on maybe about 5 years ago now. She presented with huge ascites, and we drained about 9 liters of, really chocolate-colored fluid from her abdomen. Fortunately, we were able to help her because we put her on ovarian downregulation, brought her back 3 months later, and we're able to do definitive excision surgery for her. So yes, the characteristics of the condition is slightly different in both populations, but it does cause the same devastation, the same severe pain, the same devastating impact on quality of life, the same devastating impact on fertility. So I think there is a real need for more education and more investment in tackling the condition here.
Thank you so much. And I know that when you come, we have a collaboration when you come, and I have some patients that I think will benefit from your experience. I gather them together and you come and then we operate on them together. Which other hospitals are you working at the moment when you come to Nigeria?
So I work at the Coptic Hospital. I work at the Coptic Hospital as well. I deliver services to them. So between here and the Coptic Hospital is where I do most of my reproductive care. And for reproductive medicine, there are a few IVF clinics that I work with to help deliver care to our patients. And I think that model is a really, really good one. And I think I would encourage anybody who's thinking of doing something like that to think about that model. And I'll tell you something, as you rightly said, there are loads of medical specialists in the UK. There was a survey maybe about 3 years ago that reckoned that we had about 5,000 registered Nigerian doctors based in the UK. And a lot of those people are specialists. And when we get together in the UK at social events or at scientific events and we're talking to other Nigerians, every Nigerian doctor I know really wants an opportunity to be able to come back to Nigeria to contribute something. But the vast majority just do not know how. The vast majority do not feel there is an opening for them to do so. And some are concerned about security issues, which I'm sure, you're all familiar with. So I think there is a real opportunity for the Nigerian diaspora. I believe the Department of Health, the Ministry of Health, has a diaspora unit to work collaboratively with Nigerian doctors based in the UK. And I'm sure it'll be the same for Nigerian doctors in the US, Nigerian doctors in Canada, in Europe, and try and attract talent, expertise to come back home and contribute to what we're doing. And I would say I would encourage the Nigerian doctors based here in Nigeria to be welcoming and to be receptive to such expertise. When I first started coming here in 2018, I must say I tried to collaborate with some hospitals that shall remain nameless in the Lagos conurbation, and I wasn't very well received, put it that way. And it wasn't encouraging at all, despite me offering my services free of charge, offering to pay my way, offering to come regularly and to just support and train them. It wasn't well received. I think that's something that I would encourage them to try and change as well. For the benefit of our patients and our trainees.
Based on your experience so far, if any of our colleagues, abroad, come to you to seek advice, okay, Dr. Edi-Osagie, you are conversant with the situation in Nigeria. You've been visiting regularly every 2 to 3 months. You come here and treat patients. could you advise, let's say I come to you, could you advise me
Absolutely.
how I should go about it without making any regrets?
Yeah, absolutely. I would say the first thing is that I'll tell them that it's a commitment and it's a sacrifice. So they need to be prepared to make the sacrifice. So nobody's going to pay your way. Nobody's going to compare. As you say, the week I'm here, I'm losing money in the UK because I'm not practicing there. Nobody's going to pay you for that. So it's got to be, you got to realize that it is a sacrifice and be ready to make that sacrifice. And once you're committed to it, then what I would recommend based on my experience is to try and establish a relationship with a known physician here. So for the specialty you want to practice in, try and get in touch with somebody, build a relationship with them, establish that relationship, and start doing something one-on-one with that person. And then from there, you can expand your horizons and maybe reach out to other specialists or reach out to other organizations. I am not aware at the moment if the professional bodies like AFRH, like the laparoscopic surgery body, if they offer such opportunities. But I think it's something that needs to be looked into because, as I said, there are lots of people who are looking for opportunities to engage and to be able to come home. And if the professional bodies can, maybe in collaboration with the diaspora units in the Ministry of Health, offer opportunities for things like that to happen, I think this country will be the richer for it.
Thank you so much. I think you raised a very, very valid and important point in the sense that we have a lot of society, gynecology, obstetrician, surgeons, general surgery, colorectal surgery groups, that could, take from your advice, invite colleagues, from abroad that are known to them or even not known to them to come and be operating in Nigeria. And it's something that we will recommend to the government, especially in our general hospitals where, we have volumes of patients that are going there. And the experience and the expertise of, our colleagues abroad will be very vital, at least in our general hospitals. I know that for sure.
Now, I can promise you, Latif, that if that can be done locally here in Nigeria, I make this commitment now that I can, because I belong to a number of medical bodies in the UK, I can make a connection with those medical bodies, and there will be a whole a decent number of specialists who will be interested in engaging with that system. So as I said, what people over there are looking for are just the right contacts, the right pathways, the right opportunities, and just to be assured that they will have a secure experience and they'll be ready to pay their way, they'll be ready to bring all of their expertise. So I think
I'm really, really excited to hear that. And I hope that those of us listening to this conversation, if you are in a position to help bring that to reality, getting some of our colleagues back to come and practice, especially now, overcrowded general hospitals, that will be an ideal situation, a benefit to all of our communities. Thank you for coming. Now, what has your own personal experience been? Apart, I know you said you've been to one hospital where, your legacy was turned down to come and do medical tourism free of charge. You fund your way to Nigeria, accommodate yourself, and offer free service, but they turned it down. Has that been your experience, or has it?
No. I mean, in those are in the very, very early days. In my maybe first couple of years when I started coming to Nigeria I started coming in 2018. But now I have an established system. Okay, as I said, I work with you regularly. I work with the Coptic Hospital regularly. I have an established system now where before I come, the team. Exactly, a team I work with where the team will select the patients I'm going to work on, and everything is set. And I know when I come, there's a fully itemized itinerary that works well. So my pathway is established now. So I find it very fulfilling now. I look forward to coming. I enjoy coming, and And yeah, it works well for me. And that's why I say I can use my experience over the years to try and guide other people who want to come in and do this. But it has to be a two-way collaboration. And both the people based in Nigeria, especially the diaspora unit of the Department of Health, has to engage with the specialists who are sacrificing their time, their effort, their money to come and deliver this. But I really see that this can be a wonderful, wonderful avenue for patients to get a lot of, and for this country to get a lot of healthcare, especially with what we hear now about young professionals leaving the country in their droves for greener pastures. What I'll say is that the older professionals who are out there are looking for ways to come back. So there is an opportunity.
Thank you so much. Now, let's just, we are running out of time, but let's be specific now. Let's pick endometriosis. You mentioned earlier on that when you come, the cases you are seeing are a lot more complicated than what you see abroad in United Kingdom. So how do you think we can mitigate that?
That's a really good question. And this is something that I feel the Department of Health and the professional bodies here have to really take seriously. I think healthcare awareness and health education will play a huge role. For instance, I think secondary school girls should be taught menstrual health. They should start knowing things about menstruation and what to expect from the menstrual periods. They should know that menstrual periods should not be debilitating. Menstrual periods should not be stopping them from going to school, should stopping them from engaging in their social activities. And that, if they experience, pain that they just cannot resolve any other way, they should be seeking healthcare. I think health education for me is the key. And I think once people get information of what to expect and how their bodies function and how to determine when the bodies are not functioning as expected, then they should be encouraged to seek healthcare. I don't know what's happening with the access to healthcare. I know that there was some talk about the health insurance scheme. I don't know how far that has gone. I don't know how well equipped the government hospitals are now to provide services like this. But there needs to be an avenue for young girls when they feel things are not right to be able to approach health professionals that know what they're doing and to be able to get the right interventions and the right advice. And secondly, the health professionals need to be aware as well because this ignorance about endometriosis is not just amongst patients. Our health professionals are just as ignorant as the patients when it comes to endometriosis. And so many of these poor women who are afflicted by endometriosis, the tales they tell you about going from one health professional to the other health professional and them not knowing what's going on. So I always tell people now that although we're still in the rudimentary stages of understanding what endometriosis is, but we're beginning to know a little bit about it now to the point where we feel 80% of women with endometriosis can actually be diagnosed before we get to theater. So we're not going to theater to do diagnostic laparoscopies to diagnose endometriosis anymore. We're making that diagnosis based on our history, physical examination, ultrasound scans, MRI scans. So when we go to theater, we've actually planned what to do with these women. And our health professionals need to have that knowledge. So the training courses you put on, I think they're spot on. And I think I would encourage more people to do that, to spread awareness, spread knowledge, and just give people the platform to be able to make the right diagnosis.
Positive, yes. Thank you so much. And as listeners will know, at Medicine Specialist Women's Hospital, we have a program. We do regularly visit secondary schools pupils to enlighten them that menstruation should not be a painful experience. And in the next couple of weeks, we are going to some other secondary schools around Lekki here and on the mainland to enlighten secondary school pupils about menstruation, how they should deal with it. And we often offer them, menstrual consumables at the same time. Thank you for coming. What as your patients, the one you've treated, what have they been talking about you?
Fortunately,
Feedback. So
yeah, fortunately, the feedback has been really good.
I can attest to that.
Fortunately, I am, I would say, well trained dealing with endometriosis. I work in, as you know, in the UK now, we have centers of excellence that are badged as BSGE endometriosis centers. I set up an endometriosis center in St. Mary's Hospital on the NHS. And when I left, I set one up in my private unit at the Alexandra Hospital in Manchester. So these are centers of excellence where we have the full specialists to contribute to endometriosis care, where all of our results are audited. So everything we do is evidence-based and is cutting edge. So fortunately, I would say, and what I have found is that the places I work in, both at Medicine and at Coptic, we get all the equipment we need to provide the right care for these women, which I think is crucial when you're doing endometriosis surgery. So the feedback has been excellent. And I would encourage any young women looking at this. One of the things I get challenged with by young women is that, oh, endometriosis has no cure. So why should they bother to have surgery? Well, the one thing I can tell young women is that endometriosis can be treated and treated effectively. And we can get rid of all the lesions of endometriosis. We can improve pain. We can improve fertility significantly. And what the studies tell us is that even 10 years after such surgical treatment, women are still benefiting from the improvement in pain and fertility. And of women who want to conceive following endometriosis surgery, 70% of them achieve live births. And when endometriosis comes back, it comes back in less than 50% of women. And, so there is a huge scope for eradicated endometriosis by surgery. So women who are suffering, please do not limit your options by thinking there's no cure for the disease. So what's the point? There is good, effective surgical treatment for endometriosis. And if you go to the specialists who are well-trained, who've got the expertise and got the right resources to provide that treatment, your prospects for eradicating the condition are quite good.
Thank you so much, Dr. Edi-Osagie, for coming to this podcast series, Healthy Living podcast series. It's been wonderful speaking to you. And I want to, specifically thank you for your contributions to our patients at Medicine Specialist Women's Hospital. And you even brought some consumables, laparoscopic consumables to us. I want to thank you for that as well. We wish you more success in your trips to Nigeria. And we hope that other medical practitioners abroad, colleagues who want to really prove their mettle and wants to give back, can come back easily. If you are in that kind of position and you are willing to come back, and give back to Nigerian patients, please, I'm free to be contacted. And with Dr. Edi-Osagie, we're organizing a training program in December, basic and advanced laparoscopic courses. So these are parts of the things that we're engaged in to improve healthcare services we give to our patients. Thank you for listening. And next time we are coming back with another special guest on the Healthy Living podcast series. Thank you. Bye for now.